If we could have everybody take their seats. We got anybody in the hallway that needs to be reminded that we're starting? Thank you for looking at that, Angela. Good morning, everybody. I'm George Isham. I'm the chair of the Institute of Medicine Roundtable on Health Literacy, and I would like to extend a very warm welcome on a very warm day in Washington to each one of you. And our topic today is informed consent and health literacy. I think that's going to be a very important conversation. I know I'm looking forward to it, and I hope you are as well. I want to make sure that you all know that this meeting is being recorded and videotaped. And can you hear me all? Good. As one of our major activities, the Roundtable sponsors workshops for members and the public to discuss issues of importance and concern. We are extremely pleased to be able to convene this meeting to discuss informed consent and health literacy, and particularly the ways in which informed consent regulations can affect health literate communication. Regulations that govern the obtainment of informed consent for treatment and research are crucial to ensuring that medical care and research are conducted in an ethical manner with the utmost respect for individual preferences and dignity. Yet these regulations often require or are perceived to require that informed consent documents and other materials contain language beyond the comprehension level of most patients and study participants. It's our hope that this workshop will help to close that gap between what is required in the informed consent process and communicating it in a health literate and meaningful manner to individuals. We also hope that the meeting will foster additional dialogue among existing organizations and individuals about the importance of and possibilities for health literacy efforts at many levels. And I've already talked to the lawyers today about how we need to make sure that it also penetrates the different segments of society that contribute to providing health literate informed consent, such as the legal profession, medical profession, organizations, and so forth. We hope this meeting will foster additional dialogue among existing organizations and individuals about the importance of and possibilities for health literacy efforts at many levels. And I will be asking each roundtable member, and you know this is a reminder I give you each time we meet, to throughout the day make sure that you're noting key concepts, reflections and ideas, as well as your questions that you will bring out in the conversation. You know, a health literacy dialogue, roundtable dialogue, is very important, I think, in terms of discussing issues and through our webcasts and printed materials, you know, disseminating those materials. But, you know, it's much more important for each roundtable member and the members in attendance here and, in fact, on the web to be reflecting on and commenting on that, because it makes the dialogue that much richer and the product that much more valuable to those that see our videos, read our workshops, and attend this meeting in person. So at the end of the day, I will be going around the room and asking each roundtable member to briefly identify some of those key concepts and ideas as we hear the discussions and reflect on them over the course of the day. So this workshop, like all of our workshops, is organized by a planning committee. And I want to extend our thanks to the members of that committee: Lori Hall, Kim Parson, Lori Myers, Michael Pashorlo, and Chris Trudeau. Thank you so much for your efforts in putting together this conversation. Our first presentation will be on the ethical imperative to gain informed consent from patients and research participants, or why should we care about informed consent? Our first presentation will be on that topic. Our second presenter will discuss the commission paper that she and her team wrote for the Roundtable entitled Best Practices and New Models of Health Literacy for Informed Consent, Review of the Impact of Informed Consent Regulations on Health Literate Communications. As is our custom, we'll ask you to hold your questions until after both presentations are completed, and then we'll have a discussion period. Melissa French, who's Roundtable staff and who's been key in putting together this conversation, I thank you, Melissa, for that, will also have the enviable task of keeping track of time. She will be giving each speaker a 5, 2, and time up warning. And so we're going to hold up that card again, not only to show it these two, but other speakers that may be in the audience. This is Melissa, where Melissa is. And if you don't pay attention to Melissa, you're in deep trouble. So thank you for doing that, Melissa. I'll briefly introduce our first two speakers. This will be brief, and there is additional information about their background and biosketches in the materials, in the biosketch sheet that is available at the front desk and in your materials. So first we have Dr. Jeremy Sugarman, is the Harvey M. Meyerhoff Professor of Bioethics and Medicine, a Professor of Medicine, a Professor of Health Policy and Management, and Deputy Director of the Medicine at the Berman Institute of Bioethics at Johns Hopkins University. He is a leader in the field of biomedical ethics with particular expertise in the application of empirical methods and evidence-based standards for the evaluation and analysis of bioethical issues. His contributions to both medical ethics and policy include his work on the ethics of informed consent, umbilical cord blood banking, stem cell research, international HIV prevention research, and global health and research oversight. Our second speaker is Dr. Linda Elduri. Dr. Elduri is the endowed chair and director of the Herschel S. Horowitz Center for Health Literacy and associate professor in behavioral and community health at the School of Public Health of the University of Maryland in College Park. The center was created to advance the science of health literacy and to evaluate communication tools and messages used by government, media, and healthcare settings. Her research focuses on the role of health communications in improving health literacy. So we have a really terrific pair of speakers to start off our day. Dr. Sugarman, please get us launched here. Thank you.